The PAP Flap is a great option for someone who might not have enough abdominal tissue or would prefer not to use their abdomen. We see some patients that are very thin and fitness is a core part of their life, either running, swimming, doing triathlons, and they might prefer not to use their abdomen as a donor site. So in those patients, the SCAP or the PAP can be a great alternative. The PAP is tissue taken from the medial thigh, either in a transverse or a vertical dimension, and that can be shaped to do breast reconstruction in those patients. The advantage of that is that, similar to the gap, the muscle is just spread to retrieve the blood vessels to keep the tissue alive. So it's very minimal impact on someone's function. And secondarily, people often get a thigh lift. So the incisions used for the PAP are the same incisions used for a cosmetic thigh lift. So there can be an enhancement to the aesthetics of the thigh where the tissue is taken from.
PAP flap surgery is challenging because you're going to use smaller vessels than typically a deep flap, and your dissection is going to be more hidden as you go through it, and then you have to be very careful in how you're approaching the surgery to make sure that you get the best possible result, you get the closure as nice as possible, and that you're using it to shape the breast. More of those shaping techniques come in to set yourself up for subsequent surgeries.
The thigh area after the removal of the PAP flap is closed like the cosmetic or aesthetic procedure for medial thigh lift. We employ the same techniques that we would use in the cosmetic medial thigh lift by placing the scar a little bit more in the back so it's not visible, spending a great deal of time to close these incisions in the most aesthetically pleasing way.
The recovery of the PAP flap is very similar to the deep flap. You spend 2 days in the hospital. We get you back on your feet day one, get you walking. You're under the ERAS protocol to minimize pain. You go home after 2 days. At about 2 weeks, strains come out. We get you into physical therapy at 3 weeks and progressively get you back to regular life by about 6 weeks.